Sessions one after the other. Yesterday, we used the same thing that we did yesterday, whereby we listened to both our speakers, and then thereafter we took questions. So we will do the same today. And we will go in the order that we have in our program already. We're going to start with Dr. Diabagate. If I've been trying to pronounce and rehearse it, but she will assist me when it is time on the correct pronunciation. But I want to read a little bit about her, so that we can all just have an understanding of our area of specialty, and you can better be prepared. Dr. Kadiatou is a UK-trained general practitioner currently practicing in the Logan area. She initially trained as a pharmacist also in the United Kingdom. She is passionate about women's health and improving access to healthcare in low-resource settings. This led her to become involved in health charitable activities in the rural town of Idofian in Kwara State, Nigeria, and also in Kigali, Rwanda. She aspires to continuous self-development with the aim of positively influencing the lives of others through mentorship and the empowerment of the less privileged. She aims to get involved in drawing up health policies, both locally and internationally. She is here to speak to us on stress-induced health problems. Please help me join her to appreciate her as she comes to the podium. If you've got any question during our talk, please write them down and give it to one of our ushers. Thank you, ma'am.
Thank you very much. Can I get someone to help me with the pulpit, please? Thank you. So, good morning, everyone. Good morning. Thank you for being here for the presentation. So, my name is Kadiatou Diabagate. As has been said before, I'm a general practitioner out in the Logan area. I've been given the task of delivering this session in which I will be talking about health challenges influenced by stress. And I'd like to take the time to say thank you to the organizers for giving me this opportunity. And also, if there are any other doctors here, to acknowledge their presence. Okay, so with any medical presentation, it's always a good idea to have a brief summary of what will be talked about, and this is it here. I'm not going to go into details because I don't have enough time, but this is what we'll be talking about. Okay, so this is Sarah. Sarah is stressed, okay? Stress means different things to different people, but essentially what stress is our emotional and psychological ability to deal with those pressures. So those pressures can be anything that's new, threatening, or unexpected. And our ability to deal with it depends on our early life events, our socioeconomic resources, and our personality. Where stress becomes a problem, though, is when it is defined as chronic worry. Chronic in the medical world just means anything that's been going on for a long time. So, stress can be good. And stress is good when something like this happens. Okay, so under those circumstances, stress is short-term, the fight or flight response is activated, and stress here is protective. But of course, stress can be bad. It's bad when it's long-term. The brain physiology starts to be affected, and under those circumstances, stress is destructive. So, how about the science of what happens to our brain when we're stressed for a long period of time? Here it is.
Chronic stress, like being overworked or having arguments at home, can affect brain size, its structure, and how it functions, right down to the level of your genes. Stress begins with something called the hypothalamus-pituitary-adrenal axis, a series of interactions between endocrine glands in the brain and on the kidney, which controls your body's reaction to stress. When your brain detects a stressful situation, your HPA axis is instantly activated and releases a hormone called cortisol, which primes your body for instant action. But high levels of cortisol over long periods of time wreak havoc on your brain. For example, chronic stress increases the activity level and number of neural connections in the amygdala, your brain's fear center. And as levels of cortisol rise, electric signals in your hippocampus, the part of the brain associated with learning, memories, and stress control, deteriorate. The hippocampus also inhibits the activity of the HPA axis, so when it weakens, so does your ability to control your stress. That's not all though. Cortisol can literally cause your brain to shrink in size. Too much of it results in the loss of synaptic connections between neurons and the shrinking of your prefrontal cortex, the part of your brain that regulates behaviors like concentration, decision-making, judgment, and social interaction. It also leads to fewer new brain cells being made in the hippocampus. This means chronic stress might make it harder for you to learn and remember things, and also set the stage for more serious mental problems like depression and...
Okay, so that's what it does to your brain. Now, this is Chidi Abonu. He's a 35-year-old Nigerian. He's currently over the moon. He just obtained his visa, his study visa to Australia, after 4 very long attempts. But part of his euphoria is also coming from the fact that he will finally be able to achieve all these very long-term goals. He'll be able to marry Folu, his long-time girlfriend. He'll also be able to achieve having a big house in the village, making more money, and having children. He's getting older, of course. And here is Mama. Mama will finally be able to wear all the attire that she needs for the August meetings, because he'll be making more money. Now, unknown to him, all these are preset stressors even before he gets to Australia. He finally arrives in Australia and realizes that in the land of milk and honey, the grass isn't always greener on the other side. He starts his study program, and here it is, starting his PhD, and then he starts making money, and he realizes actually he needs more money to make both ends meet. So he starts looking for another job, and then as he's looking for a job, they keep asking him about a PR, whether or not he's got a PR. And then he realizes in order to live a life of comfort in Australia, he needs a PR. Before achieving building this big mansion in the village in Nigeria, he actually needs a place to stay here in Australia. So even a room in someone's house will do at the moment. Then there's Folulola that keeps calling him about when she'll finally be able to join him in Australia and when they'll finally be able to get married. And there's cousin and auntie and far distant uncle that keeps calling about sending some money. And as he scrolls through Instagram, he realizes, Emeka of yesterday has already started building his house in the mansion in the village. So peer pressure is starting to build up. So, Chidi is stressed, okay? But does he recognize it? He's starting to find it increasingly difficult to concentrate. He can't remember basic conversation like the data analysis that he had with the supervisor the day before. And worst of it all, he's starting to be very impatient. He's snapping at everyone, including his supervisor. Now that can't be good. Together with these psychological symptoms, here are some of the physical symptoms that he's also displaying that mean that he's stressed. So let's look at some chronic health conditions that are influenced by stress. We'll start with the cardiovascular system. So during a period of stress, the two hormones that are stress hormones are released, adrenaline and cortisol. These are two stress hormones. These two hormones, being in the bloodstream over a prolonged period of time at higher than normal levels, will lead to your blood pressure going up. As the blood pressure goes up, the heart then has to pump faster and harder to be able to pump blood around our body. As that happens, the heart starts to get bigger and is less able to pump blood around our body effectively. This gives rise to the condition known as heart failure. This concept is the background of some other cardiovascular conditions happening, such as a heart attack, a stroke, arrhythmia, which is an irregular heartbeat, and sudden cardiac death. So, hypertension. What is high blood pressure? We're not going to go into it, but basically it's the force at which your heart is pumping against your vessel wall to pump blood around your body. So we don't have time for the video, so I'll move on. So back to the topic of the day, increased stress will lead to increased level of cortisol. Remember, cortisol is the stress hormone. Increased levels of cortisol mean that your blood vessels become stiff, okay? So your heart has to pump against that stiffness extra hard. And as that happens, your blood pressure goes up. Okay, so this is another word for heart attack, okay? Stress, together with other risk factors, predispose you to developing a heart attack.
Oxygen-rich blood to your body through a large artery called the aorta. Connected to your aorta are small arteries called coronary arteries. Blood flows from your aorta through the coronary arteries to supply your heart muscle with oxygen and nutrients. During your heart attack, blood flow through one of your coronary arteries may have been severely reduced or completely blocked. Your reduced blood flow may have been caused by a buildup of a fatty substance called plaque in your coronary arteries. If this plaque became disrupted, a blood clot might form and severely worsen the narrowing, or lead to a sudden, complete blockage, stopping blood flow down the artery.
Okay. So that is when a heart attack happens. Now, let's go back to Chidi. Remember him? So he's been in Australia for quite a number of years now, and of course, his family calls on and off, and one day he gets a call from his brother. Let's see what his brother has to tell him.
Hello, brother. Bon. Yeah, good morning, brother. Chicken. No, brother, it's not about speaking English now. This is not the time to start speaking English. It's been over 30 years you went abroad, overseas. There's no one useful thing that you have said. $1 we have not even seen. The only thing you keep sending is picture. Brother, it's not like I'm raising my voice. I'm just trying to call you to tell you the message. The only thing you have sent to us is a winter jacket. I know you have to go on here. It doesn't get cold here. The other time I wore it, I almost died though. So the pastor said I should tell you that the generational curse that followed our family, that you didn't break your own. So they followed you, the ancestors followed you abroad. So you have to come back because we are tired of sending money to you.
Okay. So obviously after that conversation, Chidi is very upset. In fact, he goes to bed that night being extremely angry. But he notices that the intermittent palpitations that have been going on for quite a number of months now, every so often, that night they've been happening a lot more often. In fact, he notices that his heart is starting to skip beats. This is what is happening to Chidi.
A group of cells in the heart, called the cardiac conduction system, uses electrical impulses to control the speed and rhythm of each heartbeat. Each heartbeat starts in the right atrium in the sinoatrial or SA node, then spreads through the walls of the heart chambers, called the atria, and ventricles, causing them to contract. This process repeats with each heartbeat. Problems with the cardiac conduction system cause the heart to have an abnormal rhythm called an arrhythmia. This may cause an irregular pulse.
I'd just like to say, God is good, isn't he? Like, there's electrical activity in your heart going on even as we speak. Yeah, he's amazing. So, coming back to the types of arrhythmia. So basically, an arrhythmia just means an abnormal heart rhythm. Okay, so the different types are way out of the scope of this presentation, but suffice to say that the most common type of arrhythmia is atrial fibrillation. The deadliest, though, is ventricular fibrillation. Let's look at some statistics from the Australian Cardiac Research Institute that says 1 in 10 will die suddenly due to an arrhythmia, 40 die of an arrhythmia every day, 1 in 4 will experience an atrial fibrillation episode in their lifetime. Now, this is what's quite frightening. About 200 under 18-year-olds each year will die due to an arrhythmia, and half of them will be unaware that there were any underlying issues. Now, like many, many different medical pathologies, the causes of them are endless. But what I'd like you to get out of this slide is that some of the causes of arrhythmia are preventable, like thyroid disease and electrolyte imbalance. So say if we all set a date, whether it's our birthday, whether it's the birthday of the child, where we say on this date, every year I'm going to go to my doctor to have a routine blood test done, some of these things will be picked up, okay, preventing you from going on to develop an arrhythmia. And also, another thing that goes unnoticed, people who are heavy snorers are at risk of developing arrhythmias. The complications that happen as a result of irregular heart rhythm are blood clots. Those blood clots break off from our heart, travel to our brain, and cause us to have a stroke. Leads to heart failure. Now, I'm sure we've all heard of someone who's died in their sleep. A lot of those patients would have had symptoms over several months and just did not attend to it. And suddenly, one day, as they were sleeping, they go into ventricular fibrillation and they just die in their sleep, okay? So it's quite serious and needs, if you've noticed that you've been getting palpitations, please get to see your doctor. Okay, so this picture shows the heart and the different chambers of the heart. And these things that look quite insignificant are actually very important, and they are the valves. So flow in and out of the different chambers of the heart is controlled by these very little things that God has put in place. Okay, sometimes they become diseased. This is a type of valve, okay? Not all of them look like this, but this is a type of them. So this is when it's closed and it's working as normal. It's in the closed state. And this is when it's in the open state, okay? It's working as normal. You can see the gap when it's open. This is a type of valvular disease. Again, there's several different types of valvular disease. So when it's supposed to open and it's disease, you can see that it's not opening properly. Then there's a small gap. And when it's supposed to be closed, where the space is obliterated, you can see that there's still a big gap when the valve is supposed to be closed. Okay, so this slide is a little bit complex, but please bear with me, and if you have any other questions later on, please come and see me. But it's a very important slide. There is some patients will have no symptoms, that have valvular disease, will have no symptoms at all, and suddenly they go into sudden cardiac arrests, okay? Thankfully, the percentage of patients for whom that happens is very small. However, most patients will have very vague symptoms, like feeling tired all the time, getting palpitations on and off, and feeling dizzy. Now, these are the most important symptoms that can be indicative of the fact that there's valvular disease: shortness of breath, chest pain, and fainting episodes. If all three of them happen at the same time, It's called the triad. And it's almost certain that there's a problem with your valve. Let's look at the prognosis. Prognosis basically means your survival rate, your likelihood of surviving if you have this condition. So sudden cardiac death is more common in patients who have symptoms, okay? And even more likely when patients have this triad of symptoms. So let's consider a type of valvular disease. So it's severe aortic stenosis. Patients who have no symptoms and see their doctor and they get diagnosed and go on to have intervention therapy by a cardiologist, more than 50% of these patients will be alive after 2 years. So they get found, they don't have any symptoms, they get found and they have surgery, they will live longer. Those who have severe symptoms though, and develop symptoms and are then found because they go to their doctor because they have symptoms, even though they go on to have surgery, less than 15% of those patients will be alive after 2 years, even after surgery. So we all go to the doctor here either for a repeat prescription or because you've got a cough or cold or whatever it might be. Please, at least once every year, get your doctor to place a stethoscope on your heart, on your chest, to listen to the heart sound, because you might not get any symptoms, but they might pick this up because they've listened to a murmur. If you don't take anything from this presentation at all, take this away. At least once a year, a doctor must listen to your heart sound. Okay, my time is up. Anyway, I'll be a few more minutes. So the purpose of this slide is not to define what diabetes is. We all know diabetes is an increase in blood sugar. But what I'd like you to take away from this is that stress even has an impact on conditions like diabetes. Why? Because when you're stressed over a long period of time, you release cortisol, which is a stress hormone. Cortisol in and of itself increases your blood sugar. That's without you eating anything. Cortisol will increase your blood sugar. And so that blood sugar will be on top of anything else that you will eat. It will further increase your blood sugar. So it's been found that there is a strong link, after doing this study in Sweden, looking at 7,500 men, there is a strong link between stress and the risk of developing diabetes. And the reason for that is that the cortisol hormone reduces your body's ability to respond to insulin. Okay, so other systems that stress will impact your immune system, your reproductive system, particularly in men, their testosterone will go down. They'll make less testosterone, and then they will make less sperm cells, okay? It causes anxiety and depression and other conditions like plantar fasciitis, which is where you get pain at the bottom of your heel. Okay, so if you can answer yes to either of these questions, you may be depressed. If it's yes to both of these questions, I strongly suggest that you see your doctor. Christians can be depressed also, okay? Okay, on to management. I'll be very quick. So conservative ways of managing stress. I wonder what would have happened if Chidi, before leaving Nigeria, said to himself, Lord, I'm going to a different country. You show me what is necessary for every season in life, as opposed to me setting up my own goals and aspirations. That would have been much easier on him. And if, whilst leaving Nigeria, he had this honest conversation with his family to say, I'm leaving, but I'm not your savior, okay? And, you know, other things like acknowledging self, well-being, managing our time, being frank with ourselves that we're tired and reaching out for help. And there is something called a mental health service. Oh dear. A mental health plan where you get to speak to a psychologist about your stress levels. Now, this slide is extensive, but for everyone between the ages of 45 to 49, Medicare will fund for you to sit with either a doctor or a nurse to have a tip-to-toe summary of your health. And the aim of that is for diseases to be picked up early, okay? So if you've not had one, go to your doctor because you're entitled to it. Cardiac health assessment, everyone between the ages of 30 to 74 is entitled to a full cardiac health assessment every year, done once every year. And that's where all these other conditions get picked up. And then I'll talk about a CT calcium score. I'm running out of time. So this is something that is worked out during your cardiac health assessment. So the Australian cardiovascular risk is a tool that is used to work out your probability of developing cardiovascular disease over a 5-year period. And by cardiovascular disease, we mean anything from a stroke to a heart attack to peripheral vascular disease. Okay? It uses a specialized calculator that takes into account risk factors such as blood pressure, whether you have diabetes, and your age. What you want the outcome of that calculation to be is less than 10%. Anything over 10% says that you are at high risk of developing any of those conditions over those 5 years. Okay, so once that's been worked out and you've been defined as being at high risk, what your doctor should be doing is referring you for one of these, which is a coronary artery calcium score. Here, in this CT, and this only looks at your probability of developing a heart attack. In this CT, so this is your heart. In this CT, you can see this very important vessel that provides blood to your heart muscle is very patent, very free. In this one, you can see that calcium is deposited in the walls of the artery. This means that there is plaque, fatty deposits, and you are at high risk of developing a heart attack if your CT calcium score looks like this. Now, the important thing to note is that if you go for one of these and you are actually having symptoms, by that I mean chest pains, this CT scan is not valid, okay? You should be referred to a cardiologist immediately. This is just an idea of your risk. And I have to stop. Oh, can I play this video very quickly? So we all talk about cholesterol. We all know that cholesterols are really, really bad for you. This is why.
These cholesterol molecules precipitate on the artery's surface. Then it leaks through the gaps of the epithelial cells. They form a deposit in between the tunica interna and the tunica muscularis layers. This fatty deposit is called plaque. As the plaque grows bigger, spreading in the artery, it bulges in the lumen, forming a lump, and this reduces blood flow. This is epithelial cells may split at a point. This situation activates platelets and enables the formation of fibrin threads. Clot forms as a result. This clot is known as thrombus and prevents the blood flow in the arteries.
So remember that this process can happen in our brain, in our heart, and in our peripheral vascular system. Now, many studies have found that using anti-cholesterol medication reduce the rate at which this happens in our body, okay? So I say that anti-cholesterol medication, statins are your friend, especially if you've been worked out as being high risk in, during your Australian cardiovascular score, and it can prevent you from having a heart attack, and if you've had a heart attack, it can prevent you from having another one. I think I will stop here.
Thank you very much.